Good morning. My name is Alexandra Lansky from Yale University. It's my pleasure to be here with Dr. Perin from the Texas Heart Institute. We're going to be talking this morning about the FOCUS trial that you're going to be presenting at the late-breaking trials. Can you give us a little bit of background on the study, please?
Sure. The FOCUS CCTRN trial is a stem cell therapy trial that was performed by the Cardiovascular Cell Therapy Research Network, which is an NHLBI funded network that comprises 5 clinical centers. And this trial was a trial that was the multi-center, randomized, double-blinded, and involved 92 patients. It's the largest trial of autologous bone marrow cell therapy, which was the therapy that was tested in the patient population of ischemic heart failure. So patients that had no options for revascularization, had ejection fraction less than 45%, and had some degree of reversibility by SPECT.
And in terms of findings, what are the key findings from your study?
Well, it's interesting because the stem cell field is a nascent field, and we really don't know which endpoints are the right endpoints to evaluate. So we pre-specified 3 primary endpoints, and in terms of the 3 primary endpoints, the study was negative, which was end systolic volume, change in MVO2, and change in reversibility. But on the other hand, left ventricular ejection fraction, which is a very meaningful parameter in cardiology, was positive across the cohort. Now, I would really think that the most interesting part of the trial that is really helpful to us as we move forward in designing new trials and understanding the therapy, because that's the objective of what we're really trying to do. We're in the beginning of cell therapy and want to understand how things work and where to go, is that there was a significant benefit in certain subgroups relating to age and relating to cell type. So when we divided the population of the study by the median, the younger half had a significantly greater improvement in ejection fraction than the older half, and this was independent from anything else. And on the other hand, if we looked at patients that had CD34 cells and CD133 cells at baseline that higher, well, this independently predicted an improvement of ejection fraction. These patients had a higher ejection fraction even if you adjusted for age or treatment. And finally, an important measure of cell function, how well the cells grow, called ECSC, which is an endothelial colony forming cells, and is very important because in autologous therapy, the treatment is not always the same. If you're an older patient with comorbidities, your bone marrow cells aren't as strong as if you're a younger patient. So we saw that the cell function, when it was again divided in the higher functioning half of the cohort of the study, these patients had a significant improvement in MVO2 of 2.5, which is very meaningful clinically. So this really sort of points us in the directions that we need to go.
Well, I think you make some excellent points in terms of the trial design, the endpoint selection, etc. So what's the next step here? Are you going to go to a FOCUS 2 trial?
Well,
bigger study? What do we need to do?
This is the third, actually, FOCUS trial, so it's really based upon smaller trials, one of which was published last year. And so the network actually has now been funded for another 7 years, and we are very actively planning several trials. And the knowledge that we have gained and that we are gaining, because all the samples have been stored in a centralized biorepository, and so we have ongoing analyses going. So we're applying these things to these new trials using different and the same, but tweaking, finding out the patients that will respond better as we start these new trials.
And at the end of the day, do you think that most of these trials where the results have been somewhat negative overall, do you think it's an issue of sample size? Do we need to do a definitive study in a large patient population? Different
cells will have different trials, but for those that aren't in the cell community, don't look at this and think, oh my God, it's a negative trial. No, you don't know how excited we are with this. And this really, we have learned a lot with this trial. And cell therapy and regenerative medicine in general is at the very beginning. And we're applying what we know to make some people better, but now we're learning more. So we are very, very excited about the prospects of future trials and what we can do, and there will be many cell trials available now for heart failure patients, refractory angina patients, even peripheral vascular disease patients. So we're moving forward very quickly. Okay, well, Dr. Perin, on that note, we'll end the interview. I want to thank you very much for your attention.